Having close family with breast cancer can mean you're at high risk of getting the disease.
You had to check up, have you?
However, around 95% of women diagnosed with breast cancer have no family history at all. The New Zealand Breast Cancer Foundation recommends you understand your family health history by talking about it with your parents and close relatives. This applies to men too.
I was diagnosed when I was 49 years old, and it was a shock.
I was 48 when I was diagnosed with breast cancer. Mum had ovarian cancer, then Gilly and I. So we've got a little bit of a run.
Yeah.
And although before Gilly was diagnosed, we were always sort of saying, aren't we the luckiest family? None of us get sick. And then all of a sudden, it just seems to have been one after another after another.
When looking at your family history, you need to think about both your mother's and your father's side of the family. If you have more than one relative on the same side of the family who's had breast cancer, then your risk may be higher. This depends on things like the age they were diagnosed and how closely related they are to you.
Because the women in our family are so affected, obviously. We have girls. Angela's got 2 daughters, I've got 2 daughters. We've got, I don't know how many nieces that we have. And so we are going to do a wellness day, once a year where we, the breast testing. So even, getting a nurse in and helping us, look for lumps and things like that. And then, having dinner and, just celebrating being girls in our family, and just loving each other.
2 aunties actually have had breast cancer, so it's quite alarming. And it's kind of in the back of my mind, especially, to keep an eye on Holly and my friends, just to put it out there.
Yeah, it's just you really need to watch out for yourself, and I'm worried that Emma might get it or that even I might get it, but just knowing that all the important women in your family or around you have actually gone through it, it's good to know that they're always going to be understanding and there for you if you do happen to get it when we're older.
It's very rare, but breast cancer may be caused by a gene fault that can be passed through families. Less than 5% of breast cancers are caused by an inherited gene fault. Signs that you may have an increased genetic risk of breast cancer are if any of your blood relatives have had breast or ovarian cancer at a young age, or if they've had breast cancers in both breasts, or if there's been a male family member diagnosed with the disease. Jewish people who trace their ancestry back to Central or Eastern Europe, Ashkenazi Jews, may also be at increased risk. If you do have a significant family history of breast cancer, see your GP about being referred to a breast specialist for genetic counselling and possible testing, and to plan appropriate monitoring for you. If tests reveal you carry a breast cancer gene mutation, your specialist team will discuss the options available to you.
So can we just go over that family history and check that I've got it all correct?
2 mutations, called BRCA1 and BRCA2, greatly increase the risk of breast cancer. Your breast health plan may include increased monitoring with a combination of regular breast examinations and mammograms from age 30 onwards. Some women may choose to undergo preventative breast surgery to reduce their risk.
I have a family history, and the family history is on my mother's side. So my grandmother had breast cancer and my auntie had breast cancer. And so when I turned 40, I thought, I might start being a bit more careful about my health, etc. And went to my GP, asked him if it was okay for me to be referred for a mammogram. He said, well, with the history, it's probably okay to do. And 40, 41, 42, all clear. And then at the age of 43, I was diagnosed with breast cancer. If women do know their genealogy and their whakapapa, that they look into it and find out about the health that has impacted on their whānau. And I think with that, you can be around a lot longer with the knowing and the understanding and getting the right support.
Breast cancer is going to be there for us, and we have to be mindful of that. And so, we will be respectful of it, so that we can manage it well, and manage ourselves well.
While hereditary factors are important, the reality is the greatest risk factors for breast cancer are simply being female and getting older. This means that every woman needs to be vigilant for changes in the look or feel of their breasts from the age of 20 and start having mammograms once they turn 40. So if you do think breast cancer runs in your family, find out more about it and talk to your doctor. You might just need to be checked a little more often. And remember to act on any breast changes, no matter how small, which are not normal for you. For more advice, call the New Zealand Breast Cancer Foundation on 0800 BC Nurse or talk to your doctor.